Hello, my name's Eleanor and I'm a speech and language therapist, mainly working in the stroke rehab team in Rotherham. Today I'm going to talk to you a bit about aphasia, which is a language difficulty that often occurs after a stroke or brain injury. It can affect your talking, your understanding, your reading or your writing, but everyone is different. We're going to be talking through some of the resources in your communication station box. We'll demonstrate different basic ways to support a person with aphasia to understand and to communicate as best as they can. I'm here today with a patient who has aphasia. What's your name?
Rachel.
Lovely. Rachel was training as a nursing associate in 2021. What happened, Rachel?
Stroke.
You had a stroke. Lovely. And what happened after that?
Rotherham.
Yeah, so you...
Rotherham.
Yeah.
Stroke.
Can I say what you've written down?
Yeah.
Yeah. So you were in Rotherham in the
Yeah.
hospital and you had therapy as well.
Therapy.
Yeah. And now you're doing some volunteering.
Volunteers.
Yeah, lovely. And this word here as well.
I'm improving.
Yeah, you're improving.
Yeah,
Lovely. And it's still having therapy, aren't you,
Yes.
as well?
Speech.
You're having
Physios.
OT?
Yeah.
And OT as well.
Yeah.
Lovely. All
Yeah.
right. Thank you.
Thank you.
One of the resources is a yes-no chart, which is really helpful if you can't say what you want. With a yes-no chart, it's important to ask closed questions. So, would you like a drink?
Yes.
Lovely. And people with aphasia might be able to point to the yes or no. Some people get the yes, no a bit mixed up. But yeah, that can be really helpful. If you have aphasia, you may need support when making choices. If you're struggling to express what you would like. For example, you could use written options. So would you like tea? Tea. Lovely. All right. It might also be that if Rachel was reaching across for something, I could say, do you want the pen or the paper? You might be able to choose from objects. Which one would you like? The pen. So you can use physical objects as well. Lovely. All right. For someone with aphasia, it might be difficult to say if they're in pain. You can use a pain chart to help. Are you in pain?
Yes.
Yes. Oh no. Right. Okay. Can you show me where you're in pain?
Toes.
Lovely. Rachel's pointed to her toes there. And how bad is your pain, Rachel?
5.
We pointed right to a 10.
Yeah.
The worst pain. That's not good. All right. And we can also use someone's cues and body language to work out if they're in pain as well. Okay, so another way that you can support people is using an alphabet chart. People can use this in lots of different ways. And it works in different ways for different people. So some people might be able to spell out a word if they can't say it. So Rachel, who do you live with? Lovely. So Rachel was able to spell out the word mum.
Yeah.
Brilliant. So you live with your mum. And can you tell me your mum's name? Brilliant. Lovely. So we spelt out mum's name there as well, which is great. Some people might use it to help them say the word. They might look at it and go, oh, mum, and be able to tell just from the alphabet chart. On critical care, someone might have a trachea, so might not be able to speak, so they might use an eye gaze system with an alphabet chart, but can refer to speech and language therapy for support with that. All right. And then last one, are you ready? The feeding tube one.
Oh God. I don't like it.
No, no one likes it.
Tube. Oh God.
Yeah, well.
Rubbish.
Oh, you can say that on the video if you want. I've had personal experience. Hospital can be a scary and stressful place, especially if you have a communication difficulty. So it's really important that we help people to understand their care and what's happening to them. I'm going to explain this to you, Rachel, all right?
Yeah.
So we've got a picture here of a feeding tube.
Yeah.
So this tube goes into your nose
Yeah.
and down into your stomach in the picture. So I'm going to use a whiteboard as well to help. So that is going to give you food and drink and medication as well, right into your stomach. All right. You can check someone's understanding as well. So do you feel like you understand what a feeding tube is?
Yeah.
Yeah, lovely. Yeah. So is a feeding tube, is it for washing?
Washing.
Washing? No. It's not for washing, is it? That's all right. It's for, is a feeding tube for eating and drinking?
Yes.
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 Lovely. Yeah.
Yeah.
All right. So really important to explain people's care to them. So all these resources will be in your communication station box, which is on each ward or in your community setting. So these are all simple things to try if someone's struggling to understand language or to communicate. They may not all work for everyone. Every person with aphasia is different, and speech and language therapy can advise on personalised recommendations. If a person with aphasia needs support, then you can seek further advice from speech and language therapy too.